Brain was so well gifted. So as we go along, we'll be seeing all this. Where are they located?
All right.
So today's topic is the blood supply to the brain.
The brain.
So I'm sure we have seen blood supply up to the foot. Now, to enter the brain, the blood is required to deliver oxygen and deliver glucose. These are the most important things that the brain lives on. For oxygen, is the 4.5 ml that is supplied to the brain is not suffering. Glucose is the 4 milligrams per 100 grams of brain per minute. So again, glucose must be there. Otherwise, if brain is less of glucose, those are the ones who get hypoglycemic attack, and the deficiency of glucose can make you unconscious. So that's the importance. But from the aorta, the common carotid artery starts off from the aorta. Okay. And immediately it is taking off. It is a common carotid artery. By the way, we use this artery a lot to make diagnosis of intracranial lesions, brain problems. We were using that artery.
Where is it located?
Huh?
Where is it located?
You see, from the aorta.
Okay.
So as soon as the aorta valve closes, there's the blood vessels going to the heart. We called them coronary arteries. We dealt with them.
Yeah.
Now we have reached the point where the carotid arteries are coming from the aorta to supply blood to the brain.
To the brain, okay.
Now we shall follow one channel, internal carotid artery. Internal carotid artery. It enters through carotid canal. I'm talking to the students now in Apex. The artery enters carotid canal. But before it bifurcates into internal and external. Now, at the point of bifurcation, there are two structures that creation favored this route. One, there's the carotid body to censor chemical activities of the blood that is going to the brain. There's a sensor there called the chemoreceptor site, carotid body. The students are listening. Then just at the beginning of the internal carotid now, at the branching there, there's a dilatation called the carotid sinus. Now this sinus is so special. It has a lot of nerve endings from glossopharyngeal nerve, cranial nerve number 9. The students are here listening. That one is to monitor hemodynamic, blood going to the brain. What is the pressure, the arterial flow? What is the pressure? Because this is so special, it must be controlled. So it is in belt control systems. Then when it has entered in the brain, the internal carotid, before it bifurcates into two, there's an artery going to the eye anteriorly. There's another artery going posteriorly. We call it posterior communicating artery. We shall mention this later when you are talking about basilar artery. But the one to the eye goes to supply. That's why operations in the eye, we have to be very careful. Because if you touch and start bleeding that artery, it is of high pressure. It can be very difficult to control the hemorrhage. But when it bifurcates, it gives the two branches. Today, we are going to look at anterior cerebral artery. This artery immediately takes off. It gives two small arteries which are communicating to each other. They join the left and the right. It is called anterior communicating artery. 4 millimeters on this side, 4 millimeters on this side, they join. And they supply, the rest now go to the right and the left. Let's take at the left side. The artery is going now over, I'm talking to students, over corpus callosum. And there it's very important that we know that structure. Because corpus callosum is the one that carries information from right brain to the left brain. So that the left knows what is happening to the right. It's already connected. But the artery is running over there. It's very close to the falx cerebri. Now, something can happen. I will mention that what would happen to cut off blood supply at that level. That blood is going to the medial side of cerebral cortex. Now, in the brain, there's a human structure. Human structure is there from foot up to the head, the tongue, the eyes.
What do you mean?
What I mean is that it is a drawn structure. So the neurons, the brain cells, have taken charge. You neurons on the medial side take charge of the legs. Make sure the legs are working. Supply them with nerves to use the muscles. You can't kick a ball in the direction without the brain saying, yes, kick this direction. If you kick like this, you will score. That's from upstairs there in the brain. So the brain thinks of what the legs should do, what the arm should do, and how the mindset should be like. So what we call medial cerebral cortex, that's where the leg is. So now I was saying, if somebody has a head injury and has bled in the head, and there's a hematoma, blood clot is forming, say, on the left side of the brain, it will create pressure where it is accumulating. Because the skull is a closed box, pressure will move the brain. The most medial part of the brain that goes under the falx, over the corpus callosum, and pressing on anterior cerebral artery is the cingulate gyrus. And if we don't diagnose that mass collecting in the head quickly, it will push the brain to try and go across where there's less pressure, away from high pressure because of blood clot, to the where there's less pressure. By so doing, pressure on the anterior cerebral artery will cut off blood supply to the leg. That's unfortunate. So even if you delay removing that blood clot in the head and the pressure is persisting, the patient, when he recovers, he will have no functional leg because blood supply was cut off for a long time, and it takes only 4 minutes to cut off blood supply to the neurons, and the neurons will be dead. Neurons are special cells God created for us.
Now,
they are so important because if we lose one, we have lost it forever. It doesn't regenerate.
So,
and
Professor,
yes.
just on that, so when the leg stops functioning,
yes.
does it require being amputated or?
No, because it has got its own blood supply. The only thing is what we call monoplegia. If some cells have survived, it will be monoparesis. So any head injury, the doctors do examine post-operatively or at the time of discharge. We examine the legs. The injury is on the head, but the doctor is examining the legs.
Then you might think,
yes, but you know our traditional healers will say, but why he should cut the pin on the leg, on the head? No, we know why. The doctors will examine the legs because they want to know if the radiologist reported there's the midline shift. Now we have CT scan, MRIs. If a radiologist tells the doctor that there's the midline shift, for us as clinicians, we don't look at that physical picture. We are looking at effects of midline shift. It's a cingulate gyrus. Then we say, what has happened to the anterior cerebral artery? Has it been cut? Has it been cut off? Then we want to examine, even inpatient. How can you lift your leg, Mr. Piri? Please lift your left leg, lift your right leg. And when it is on the left side of the brain, that herniation, it will also damage the speech center. It will be affected. So we also check the speech center. 2, I will explain further to say that the pupil, the eye size may change. So we are looking to the right leg because the left one, that's where the mass is. So the first artery to go will be the left artery, which is supplying the left cerebral, cortex on the left, and because the left brain controls the right side. That's why we are clever on the right side. The left brain is the dominant brain for right-handed people. So we eat with the right side. We kick ball. If you want to kick a ball strongly, you use the right leg. That's right. The bomber, yes.
Yeah.
You look at Messi, the way he scores. He uses the right leg. The left one, he can use the left and is gifted. But most of players will use the right leg for a powerful chipolopolo on the net. So that's, but the power comes from the brain cells. We call it motor cortex. So maybe nikambeko mchinyanja.
Yeah, for us.
Lero tirukamba za magazi yoenda ku bongo. Bongo ndiye chintu cha chikulu Mulungu anatipasa. Because bongo liganiza, bongo lingachinje mkalidwe, bongo lingakalea ya chimwemwe, bongonso mgachokeso vuto lokali lichoka mbongo. So Mulungu anatidalisa nazo zonse izi. Koma lero tati bongo liyendetsa mendo, liripoti, andilandira blood yokwanira bwanji. Ndimotiru kambira lero. So mtsempa opeleka bongo la mkatikati mwa bongo. Kuli mwendo. Muli chipiki cha muntu mbongo muli chipiki cha muntu. Kuli mwendo, kuli chiuno, kuli mimba, kuli chesti, kuli zanja, kuli lilime, kuli maso, kuli miromo. Chipiki cha chilipo. So maseos Mulungu anatipasa kale. Yotandiza mwendo, yotandiza chifuwa upuma bwino, yotandiza mutu wamene mkosi masozi yaende bwino, ya mpamvu ichoka kubongo. So kubongo ndiko anatidalisa Mulungu tasiyana na nyama zote. Mnamva hapo kuti njovu zaitana meeting kulibe. Batita wantu Mulungu anatidalisa na bongo. Tikozo ogwirizana mmakambidwe. Angakali tisiyane maganizo tumakumana kukhala kumuzi akuti ola kwanzikirani mpasa paja wantu nde ola kwa ni ababiri kambani vinali bwanji aheadman ali pampando ija ni meeting ya kumuzi pa level Lusaka. So using a bongo. That's why timuyamike Mulungu nyamalenga potipasa bongo lotero ziko.
Wow. Okay, manje nima tenda bwanja mina mabwera ku brain regards this artery. When it's not functioning well, there's something in the brain, but brain nima problems bwanja.
Yeah. Paja napanga example ya trauma to the head. Ngati muntu wapwetekeka mutu tima pima fika kumwendo chifukwa njira ya magazi pasipa mpamvu ya mendo ingakalea kuti ya imikizidwa. Chinaso ni infection. If there's a parafox infection, and I've seen these patients with infection in the head and the abscess called the parafox abscess, chipute chapangika mutu chiruchita presi njira ya magazi yopeleka kubongo la kumwendo. Ngati chipute chija sinachite diagnose mwa msanga chikozo wononga njira ni infection here, isn't it? Even tumors, ngati kuli tumor meneli pafupi pamene paja parafox tumor, meningioma can be, it can press on the artery. So any condition that will cause pressure on the anterior cerebral artery can damage the medial part of the brain. That's where we are concentrating today. We will go on. But the medial part of the brain where power of moving legs comes from, on the left side and on the right side.
Wow. Now, I've heard that it's dangerous for some veins to rupture in the brain, and then it can cause a lot of complications.
Yes.
Now, which part of the brain does not require blood, if blood goes there?
Mr. Chongo, there's no part of the body we cannot require blood supply. We are from the foot. If by old age the toes are not receiving blood, they start drying off and falling off. So those who are 120, 130 years, one of the signs is that the blood will be starting to cut off from the foot. Every part, especially in the brain. By the way, these neurons we are talking about, there are 50 billion in the head.
Wow.
And each neuron is guarded by 5 glial cells to support one neuron. 5 bodyguards, so to speak. A neuron is so special. That's why God gave us power to rule this planet, to control the animal population, to control trees and all that. But unfortunately, we have also done a lot of damage, knowingly or unknowingly. We have cut the environmental structure that God gave us. We shall come to that. But today we are concentrating on blood supply to the medial side of the brain.
Okay. But just for a follow-up to what I asked, because it's coming from people, I said, but mamverapo at blood in a clotting and mood. What causes that? But doesn't that blood, is it not required? Really?
But it's a problem. It's a pathological situation. Here we are concentrating on anterior cerebral artery. We shall come to middle cerebral artery. That's where strokes are common. But even in that, if the blood clot comes and goes into the anterior cerebral artery, in the same way it will cut blood supply to the brain, which controls the legs.
Okay.
Yeah.
All right. At this point in time, our dear listeners, we are now opening our phone lines so that you and us can interact on this important topic. We are using the following lines: 0972695200, 0972695200, or 0956520277. We are looking at blood supply to the brain. So those two numbers, you can call and participate on this important topic. We are looking at blood supply to the brain. Let me see if...
And I hope Chipata is listening.
Yeah, Chipata people,
Maria,
can you call? Let's see if
will,
it's Chipata here. Okay, yeah, the call goes off. You can try again on the same number, 0972695200, 0972695200. We should have a call. Hello?
Hello, good morning.
Good morning. If you can speak up.
Okay, good morning.
Morning.
Yes. My name is Tishala.
Okay.
Yes, good morning, Doc.
Morning, sir.
Yes, I have a question. I have got pins and needles on my left leg for about a week now. So what could be the problem, really?
Yes. Okay.
Yes, thank you very much.
All right. Pins and needles.
Yes, pins and needles. So is he feeling it? So from the leg, the sensors are telling the brain something is not right in that foot. Is the blood supply okay? Is nerve connections, are they okay? So pins and needles, if it's just one leg, there are possibilities. One, of course, we should look at the brain level. We should come down to the neck, the back, up to the nerves that reach the leg. We must follow that. And there, the nerve roots should be checked at the spinal level. Nerve roots. Then we should, what are these pins and needles? We should examine blood supply to the leg and the nerve connectivity to the leg. So the doctor, when he goes to see the doctor will examine. What we said, the doctor will even include palpating femoral artery, popliteal artery, posterior tibial artery, and the dorsalis pedis. That will give information on what is happening in the leg. 2, the doctor will check the sensory and the motor activity in the toes, in the foot, in the calf muscles, in the quadriceps. They will check all that and diagnose whether it's at the spinal level or from upstairs. That can be done.
So some
you should
of
go to the doctor
the
and
conditions
present.
that come about.
Yes, those are the irritation of the nerve cells in the leg that are causing pins and needles.
They are corrective.
Yes, they can be corrected. But first we must make a diagnosis. Umanena
All right, we still waiting for your call, 0972695200. Hello. I'm quite late to tamba. Lero tablet tamba. Mukasonkere.
Madam Shinondo. Oh, mwamposha hapo ngaita. Professor, Mauka.
Nauka mai Mauka bwa.
Nauka bwino. Last week, mwezamula kama va clothing ya chikeniki. Nize kuyesa tapaka manje mwe. Nalepera kuti nkambe na imwe.
Pepani.
Wijamula kama closet kuma aspirin. Manje ino mene simu kuma aspirin. Ima ni chapa mara ngati namwa. Manje nkwala bwanji.
Mukapita kwa doctor wana azakulemberani instead of aspirin. Azakulemberani like chlorpedogrel. But wa doctor wanu mkawa uze kutina aspirin si kalabu ino ima chita react. Azakupasani alternative.
Manje ya mine mwakamba ya blood kumutu. Manje kumutu ngati wagwala mutu wa professor wene mutu wanga ukadwala maveni mwanga chembo za jurika. Manje ukakala mwanga waleka bilonda kukama navo vima bweka bilonda kukama ikabweleka nishezo ya leka. Kama chilenge sabuti bilonda hivyo vichoke mkama nishinu blood si chakineti bwino. Ya number 2 Nana brother wanga balamba bikawala bilabwa achoka chapu kumtito ba multi ataki binateka bloko amota nacho kumutu kuna vimba tunatoka blood bali kwenda kwa hospital kuza brother wangu sasa delete sasa tunalengesa ni chani.
Okay hapo hivyo mutu wawa ngati tilitenta ikanipansi lomba radio mumvere.
Okay
ngati mutu wawa tupilitenta mwachita vironda ijati kuti herpes labialis ndiye problemu muli nayo. Tulimo tuma virus tuli manevu lombati gatila wawa tupila tenta tuma tuluko bwera kumiromo tupangisa tuma blisters lomba kumizi kuja kuti mutu wafuza lomba uzaleko wawa. That is not the main thing. But of course it's self-limiting. Because pakapita 4 or 5 days, tubwereramo tuja tuma herpes labialis. Ndiye tuchitisatero. Kwa mankhwala yaliko, like acyclovir, you can cut those. Okay. So yaliko mankhwala. Then brother wao, anapandiwa mutu, wavimba mutu, anapita kuchipatala, kapana natisia. Ndiye kuti inaonongeka, mbongo muja munaonongeka. Maybe mnachita ntumbira mwazi bongonso nalo likala crashed ngati kuli trauma. So depends on arrival ya patient kuchipatala wafika ntawe bwanji ndawangata afika very late Glasgow coma scale 315 the pupils the eyes are both dilated and fixed. That is very late. Look at his breathing is on and off, irregular respiration, taking and blood pressure is very high. To save that kind of patient who has come so late is very difficult.
Okay, 0972695200 is the number. I think we could have a call. Hello?
Hello, this is Mr. Kawai.
Okay.
Yes, I wanted to find out, to learn more about this disease called lipoma.
Lipoma.
Yes, sir.
All right.
Good. Very good.
Ziko mkwambi.
You're welcome, sir.
Lipoma.
So lipoma is a collection of fat which has formed into a mass. It can be subcutaneous. Commonly it's subcutaneous lipoma. It's a benign thing. You shouldn't worry about it at all. But it will continue growing. It will continue growing until we open the skin and remove it. And when we remove it, apex, we send for histopathology to make sure that we know, was it lipoma or is it something else? So it's a lipoma is a collection of fat as the mass. No, this is a ganglion. On the wrist joint, this is a ganglion.
What about on the knee?
Yes, it can occur anywhere.
Okay.
Yes.
I remember I had it on the knee.
You removed it?
Yeah, it was removed.
Good, very good. Good, well done by the doctor.
It's a cyst, something like that?
Yes.
Yeah, similar to that. Okay, 0972695200. Hello.
Hello, Mr. Chongo, how are you?
Fine, thank you, sir. How are you?
This is Mr. Banda Chumala speaking. Well, Professor Lambert, how are you?
Niligwa kai mlibwa?
Na banda kwa Paule na Professor.
Inde na vakale mau.
Yeah. Akula tatiti funseko nangangati, when they say a person is mentally disturbed, what's going on in that person's brain exactly?
Yeah. Sometimes it's family history. You can pass it. Sometimes family history. Schizophrenia, for example, is familial. You take a history, the mother's side, father's side, one of them had this problem. So you have inherited potential. But it means the brain is dysfunctional. Part of the frontal lobe, when we reach at the frontal lobe level, we shall discuss frontal lobe in detail and see how disturbances can occur in the brain and create moody, depressions and all that, but including schizophrenia. So if you take care of the brain and you prevent disturbances of panic, anxiety, fear, some people have predisposed, they all fear for anything they fear. They are just like that. But they need encouragement, they need hope creation, to make their brain not to be misdirected and they become confused. But diseases like depression, schizophrenia, they have got medicine. So don't keep people whom you think are that direction at home. Take them for care. That's why in the hospital, in Chainama Hospital, it's a specialized hospital to look after people like that. But as the children grow, we should not be bringing up children mindset of fear, anxiety. We reduce that. And as the child grows, if he's stressed, by the time reaching middle age, he may start having a mental problem. Yeah. Mental health is a real thing. We should look after the head, the brain cells very well, so that someone lives a productive and well-directed life.
All right, let's see if we have another call, 0972695200. Remember, this is the Lusaka Apex Medical University, and it is coming to you in collaboration with Lumen TV. You can watch Lumen TV on channel 101 on the top stab, okay? And also Radio Maria Chipata. And Professor, I would like to get a call from
because
Chipata.
We have opened a facility in Chipata. Apex is in Chipata.
And also, of course, Radio Maria at Sun Voice. We seem to have a call. Hello? Okay, we don't. We had a call on this other line, the 0956 5202277. We have a call. Hello? Hello? Mauka mfika pangono puntisan kodi mdara?
Tauka.
Eyo. Ni pamene pa
Bayasani, yes.
Okay. Kaitingomvera kwa chabe hapa ndiye first so ife ku inzira kwa pa program na chakuna tunateje kuze kuiona kwa station ipati hapa.
Very good.
So mtitamba ka?
So tukutambani so ni na funzo 9 na pezeka vintu pamene vilipo hapo. Vintu 9 pamene vinanjikira hapa otherwise ni pamene nezo sevenza kwa pa company penangu. So pa company hapo nabwera ninagwa pa mtenge.
So ninazichita kumutu. So mutu pamene ninazichita paja nankara almost hospital almost 3 days in check oxygen.
Oh.
So manje ninabwera nankara na problem ya kuti ninayamba kukunyuka so.
Oho.
So manje siniziva kuti kukunyuka kuja kuti ija problem ija ingasire oro bwanyi.
So it's post head injury epileptic attacks. Post head injury. They are manageable. Medicine is there. But when you go to the hospital, first of all, they will go and do EEG, electroencephalogram, to confirm the epileptic or epileptiform activity on the brain. These are electrical activity on the brain.
Okay.
And it can show. Then it can also, because of the history of trauma, they should also do CT scan or MRI. That can be done, and the diagnosis will be made, and it should be put on a treatment. Starting with a single drug, lowest dose. If it is controlling, well and good, you maintain. If it's not controlling, we add the dose. We increase the dosage either instead of twice a day or once a day to 3 times a day until we reach to the level where these cerebral seizures are controlled. So it's a manageable condition. Asakale kunyumba chabe ya.
Just a follow-up on that one. I know we'll look at what causes strokes and that. But there's someone I know who had a stroke, a stroke, but he's now developing the same problem.
Yes, it means that the stroke damaged. We shall reach that next week. We are talking about middle cerebral artery.
Right.
We shall talk about the strokes. They can also cause irritation on the brain because the epileptic fits is just abnormal electrical activity. If it's normal electrical activity, the EEG will tell. If there's something abnormal, we have different types. We have Jacksonian fit, for example. The finger may start moving, and the whole arm is moving, and the whole body goes into full-grown epileptic attack.
Okay.
So, but we shall discuss.
We shall discuss that. But, another one, Professor. What happens when someone is unconscious? Because, like he was.
Yes.
What happens? But you're unconscious, but everything else is working.
Yes. It means that the brains, the neurons in the head, in the brain, we call it supratentorial neurons. Those neurons, if they are not working because whatever the cause, maybe the pressure is very high because the blood clot has not been diagnosed, a brain abscess has not been diagnosed, that will create the brain cells stop working, but the brain stem, which controls the heartbeat and the respiration, is there. It's also keeping the life. But if you delay, and we have a measure, we are insisting our students must master Glasgow Coma Scale because that helps them. Vital signs, blood pressure, pulse rate. Glasgow Coma Scale will tell you what was it at time of admission, what was it 2 hours later, what was it 6 hours later, and what are the focal signs. Is the patient moving the legs and the arm and the eyes? How are the pupils like? So our doctors, our nurses, they are well trained in this. They should pick it up and quickly go and remove the blood clot. Then the patient starts receiving blood back to the brain and save the brain from damage. The normal blood flow is 50 to 60 mils total, 50 to 60 mils for every 100 grams of brain and for every minute. That's normal supply. So if pressure is building, that normal supply starts going down. And the neurons, they are not getting enough oxygen, they are not getting enough glucose. That's why arterial supply, today's topic, is extremely important. And this is just one artery we have been talking about.
Okay, so how different is it from induced coma and what you have just explained?
Yeah, induced coma is if, for example, doctors want to look after the lungs better when the patient is not struggling. They can give an injection to stop the brain, to sedate the brain, and allow the machines to deal with the lungs so that the lung function can be saved.
All right. Okay, still getting your calls on the same number. Seem to have a call. Hello? Okay, 0972695200. We have a call on this other line here. Hello? Hello? Wow, my line here is a bit
faint.
Okay, you can call again.
Hello?
Hello?
Hello.
Yes, you are live on radio and on TV,
Yes,
sir.
good morning, sir.
Morning.
How are you?
Fine, how are you?
I'm fine. This is Meandaraidon from Monze.
Good. Monze, I'm so happy.
Nina problem ya kumutu. Nimachito ibala ochanchane ni nacho mumanja so. Sometimes ngambo saki. So kapena munganita nzepa problem ya soyi.
Yes.
Mankwala yalipo obwanyi.
No, mankwala yapezeka. Yochita improve memory. By the way, memory registration is occurring in the a part of the brain. It's a temporal lobe. We can pass it phone and it explain
on TV and radio.
Oh, okay.
So what I was talking about, anterior cerebral artery and the corpus callosum, okay? Be just within that area, below corpus callosum, there's a group of fibers, nerve fibers, coming from hippocampal gyrus to mammillary bodies. When they reach the corpus callosum, they form fornix, a band of fibers. When there's the pressure there and is persisting, you are not treating it, you have not diagnosed blood clot, abscess, you name it, then the damage can occur. So it will cut the memory lane. So we must take history from such a patient, what happened to him, the full history, and examine him. If it's from hippocampal gyrus, we should know. And what treatment are we going to give? Because it's a long chain of activities. Recent memory, if it goes, you find patients like that, they only depend on the old memories. So even there's, the fire around the fire, people sitting around the fire, the elderly men and women, even at village level, they would tell stories of the past. That's what they remember. Ask them about recent memories. They can't register. Because the memory system of recording new memories is affected. Yeah. So I think this patient should go to the hospital. And he's in Monze. Monze, we have a powerful mission hospital there. He should go there and present the whole history. Properly. They will examine, they will investigate, they will find a solution to the problem.
All right. We'll see if we have a call on the line. If we have a call on the line. Hello? 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 Okay, we seem to have... Yes, Mulbanya mai. Yeah, Kambani kon mamsanga mai.
Sir?
Kambani.
Nikamba para Stevenson. Stevenson ndine mamai mumba.
Kuchuko.
Kaunda square mai mumba.
Okay, Kambani mai.
Nifuna kamba muli bwanja Stevenson.
Tilibu ina mai.
Ilipo muli bwanja.
Yeo.
Tilipo.
Abatoka taramba muli bwanja.
Nilibu ina mai muli bwa?
Ilipo, nifuna kuva kuziba problemu, nina problemu itokera mu msana mu kubwera ku mendo amapya. Ya mapya mendo.
Si atupa?
Si atupa ya mapya. Bonga na ponda pa moto so. Ero kumusana huku nikankhala chabe ni mashanga tiki muntu anise kana chimpeni kuti kache tonchitopunda kuti mayo
msana
so so nifuna kujua kuti nitiani
inde alright zikobo lekanti yanke ngati
nilokutambani sasa
pepani zikomo
nilokutambani zikomo
zikomo kwambiri.
So amayi mwakambabwino maningi mujatina kambira njira za magazi za yota ifika kumendo. 2 manevzi yachoka mumsana, so wakamba kuti msana ndio mavava munga chekapo kwa then mendo siwa mvera bwino mendo. So chifuniko pima ni vintu viwili, njira za magazi na mitsempa manevzi amene tikamba yafika kumwendo. So chiripo one of the two or both of them, viviri vonsi sivisevenza bwino vizavutisa mendo.
What could be the problem with them?
The problem, we must look at, in fact one of the tests they will do is to do x-ray of the lumbar sacral spine. That should be done, AP and lateral, and look at the position of the discs and the position of vertebral bodies. They should see that. 2, the doctor should examine femoral artery, popliteal, posterior tibial, and the dorsalis pedis, and the sensation in the legs, and the movement, motor movement in the toes and the foot. We have groups of muscles. Can the patient flex, extend the knee joint? All those will be done when she presents to the doctor.
Okay, we are ready for the last call before we start winding up the program on the Lusaka Pex Medical Radio Grand Round. Hello? Hello, caller. Mwibanji?
Yewo.
Okay, that line seems
to
be...
Hello, Nimpera.
Hey, kambana mbuye.
Nifunza na Ngulumeni TV huko.
Inde na ku Radio Maria.
Va Lambert va doctor Mulibwanji dadi.
Nilibuno Mulibwanji fumu.
Nilibuno va director huko.
Mulibwanji boss.
Nilibuno ise. Nili nakamwana kenangu kanabadwa chabe koyonda onda sikachinja. Manje baramba tinabaona lero pa TV munga tikandizeko kwani.
Mwabaona kambanja but mwabaona vivid boyina.
Nali kamwana koyonda nane kumunzi. But I think
kuja sasa nkavukuja bati tupi chinja.
Ali how old manje?
No, kamwana kakali almost 7 years now.
Very good.
Nakushukuru kaenda bwino.
Very good.
Nani neze koyonda ka?
Mwaka yonda. Ndoke kala twanzeru toyonda.
Okay, it's come retani mayanke.
I think okay. 7 years.
All right.
7 years. Apite naye kwa doctor. Akaone eating habit libwanji, mwana appetite libwanji, but also check the intestine, gastrointestinal tract, nanga absorption libwanji, nga mawems bwanji, nga kalemo, fuwa mwana adye mwana, but mawems jatuli mkati muja, tumudiera vakudia. So akapimiwe up to toilet examination of the toilet for over or even worms.
Maybe na type ya vakudia.
No, but yawamu abani munosanga vutiki. I'm sure akudia bwino. But balanced diet. There must be enough carbohydrates, there is fattening, and also protein and vitamins. Very important. So the balanced diet. And also check the appetite. Kudia breakfast, lunch, and dinner. But check the intestines, because that's where absorption takes place.
Maybe it's VPT. Okay, we've now come to the close of the program, but before we do, I'll do that, Professor. If I want you to say your concluding remarks.
No, I'm very excited for participation. I'm so happy. You have seen people are seeing Rumeni TV, and the people are listening to the radio. That's very good. Let's communicate. The purpose is the corporate social responsibility, and also to encourage our students and to encourage the parents who are listening. Please send your children. The whole world will require health workers all over, because the health is wealth. So please send your children. We shall train them. Send us your children. We'll give you back the graduates.
Professor Lambert.
Thank you.
All right, thank you so much. We have come to the close of the program today, the Lusaka Apex Medical University Radio Grand Round. Remember, enrolling is still taking place. If you want to know more, you can call the Corporate Communications Department on 0977 751313. That's 0977 751313. Or indeed, you can contact the PR office on 0954 888494. 0954 888494. Indeed, you can also visit the Lamu, Facebook page, and also on Twitter. It's Apex Medical Uni, at Apex Medical Uni, and we are also on Instagram. So visit the website and you'll find all the details that you would want to know about the university and about what they offer. It remains for me to say thank you so much to my guest, Professor Turkson Lambert, for the insightful explanations on various aspects of the brain. Join us next week as we continue looking at the brain itself. And I also would like to thank the crew in the studios for the TV production, manning the cameras in the studios. We had Messi Mshanga, and also the director of the production, Sydney Mwamainda, and the technician, Martin Monde. And for the radio, we had Geoffrey Banda on the techniques and Mazombwe Banda. This has been Stephen Chongompuku. Enjoy the rest of the programs. And thank you so much, people of Chipata, for tuning in, and people of Lusaka and elsewhere. Follow us on our Facebook page as well. Bye for now.
Your aspirations of healing mankind and a high-profile career are made possible here at the Lusaka Apex Medical University. We offer high-quality medical education with the best technology for your learning. You will learn from professorial teams dedicated to academic quality and standards. Enroll with us for Diploma in Physiotherapy, Nursing, Midwifery, Bachelor of Medicine and Surgery, Pharmacy, Science in Nutrition and Dietetics, Physiotherapy, Environmental Health, Public Health, Diagnostic Radiography, Nursing, Masters in Public Health and Radiology. In the new normal under COVID-19, we offer online classes where our students can interact with their professors. Lamu, where knowledge and excellence meet.
Umulimu w'abengisha enchito gushomwa alishuba okutila abengisha enchito bonse mu Zambia balingira